I thought everyone here, when I interviewed, they were very engaging. They were interested in me, what I did outside of medicine, what I wanted to do with my career, how I saw myself. They asked about pretty much everything about me, my family, and things that were important to me, and they were actually warm and very interested in it.
So I think what's really great about the Upstate Residency program really is the sense of family amongst the residents and also amongst the faculty and staff. It's something that I, as a medical student rotating through various different specialties, really haven't seen, and it's something that is present in great abundance here.
I like the collegiate atmosphere that they have here. Everyone knows everyone. We have a really good relationship with other specialties, including Hem-Onc and Surg-Onc. Of course, the brand new cancer center was very nice, and it's nice to be on the first floor and not in the basement for once.
I think what makes our residency program stand out is we have leadership that cares about the residents, that cares about their well-being, that cares that they're in a supportive learning environment. They're getting opportunities to do research, that they're getting opportunities to practice procedures, to become experts at procedures even as residents because of how many cases we have.
It's like just the right amount of, I'm expected to work very hard and very smart, but also I'm respected as a person. So that's different for me.
The residency program here is multifaceted. We have many different types of treatment modalities, from gamma knife to HDR to external beam. There's no substitute for hands-on training for making a true professional. Certainly for physicians, they need experience and to gain confidence. You don't really learn anything until you see something that's unusual.
Radiation oncology really has a lot of procedures. Us residents get to do those procedures, and I think that is one of the single greatest benefits to coming here to Upstate.
You can learn a lot in medical school, but your residency is your on-the-job training, and so the more hands-on experience you get, the better you're going to be as a physician going out there, and the more comfortable you're going to be, right? Because every time you run across a strange case, you'll think back to your residency like, oh, I saw that this one time, and you'll have a better understanding of what to do in that instance, because no patient is the same. Nobody comes in, as the textbook presentation. Every person is different, and so you have to kind of treat their cancer potentially differently.
The residents learn to be the provider, they learn to be the proceduralist. They learn to do radiation plans for brachytherapy patients where they've actually placed the radiation devices, and then they're seeing these women, they're seeing these patients in follow-up afterwards, and they're seeing how well they do, and they're following that their cancer has been successfully treated along with us, and we're managing any side effects together from their treatment. They know that when they graduate, they'll be comfortable treating cancer patients with radiation oncology and all of the different technologies that we have available here.
All residents get involved in research, and I think cancer as an entity lends itself to always wanting to do better, find new things. So I think anybody involved in cancer care, in essence, is devoted to doing research. I think we have a lot of resources here to help, and if you look in the last 2 years, we've recruited some more academic type faculty, including faculty that have their own lab, which is another opportunity for our residents.
I think it's important first for the patients, and that it gives them more access to clinical trials and other options of therapies that they may not have in the community. And for the residents, as they come through training, it teaches them what is up and coming in terms of new treatment paradigms that may be coming into play. And it also helps them develop their own investigational style by getting involved in research projects. With the initial building of our cancer center and the new setting that it's in the last 5 years, we've really expanded our use of research technology. We've opened more clinical trials. We're a large part of the Alliance and Radiation Therapy Oncology group, the RTOG and NRG sites. So we have a lot of national trials as well as investigator-initiated trials and bench work here.
It's really a patient-first approach, and patient-first approach embodies doing the right thing for the patient, learning for the patient, being evidence-based, and communicating and coordinating care as a team for the patient. It's really incredible how when people hear that you're involved in cancer care, they think it's morbid or depressing, but in fact, our patients are some of the most appreciative patients. It's beyond what you would really expect in terms of the satisfaction, the appreciation, and how humbling that is.
We have a pretty wide range of patients that come in all the way from north near Canada, down to even like the Pennsylvania border. And we're really the largest, tertiary care center for those patients. So we really get a lot of, different patients from different areas, and I think that's a great learning experience for the residents.
Everyone here is focused on making sure you're the best resident you can be. They really, everyone is focused on your education. Everyone wants to kind of help you succeed. You always have this support system where if you have any questions, you can go to them. So you never feel like you're overwhelmed. So you can kind of find your own boundaries, and then if there's any questions you have, attending these residents, there's always someone there to help you out.
The residents get to know everybody. The residents get to sort of know the ancillary staff, get to know the patients, and feel as though they're a part of the community, which really enhances their ability to feel involved in taking care of those patients and making their education something that they really fight for the whole way. It's really our pleasure to be training the next generation of radiation oncologists. Getting to train them and getting to watch them grow from their first to last year is something that gives us a lot of satisfaction and really makes us better doctors and feeds right back into the strong patient care that we're so proud of. I would say that the training at Upstate is full of high yield education with a family mentality.
The residents represent the future of our specialty, right? And they actually keep us on track, they keep us motivated, and they help us actually to do the right things for patients. So I think they're a critical part. We see everybody, right? So we have all walks of life. We don't turn away anybody based on insurance. So we have some very high-end procedures, but we treat everybody the same, and it's really a fantastic way to practice.
The reasons to pick radiation oncology here at Upstate would be to get great hands-on training with clinicians who are dedicated to patient care, to see the wide breadth of cases that we see here, and to work intimately with every facet of cancer care here in the Upstate Cancer Center.
That's one of the strengths of our program, is being at one location throughout residency. It really allows us to develop those personal and professional relationships with our mentors, the staff at the cancer center, and with our patients.
This is a cancer center and a hospital that's the major trauma center for a large part of the state, and Syracuse is a nice place to live. So I would recommend it to someone, definitely.
It's very focused. It's growing, so there's opportunity in every corner. It's in a place that's beautiful and has a great lifestyle outside of what you're doing in your residency. People stay here. People who've done residency here like to stay here, and that says to me that it's a place people feel welcomed and want to stay.
I look forward to coming here to work every day, because I know when I get here I'll have a full team of supportive staff ready to hit the ground running and get started with me and help me provide the best possible patient care.
I love that we're kind of at this crux between science and technology and medicine. With this machine you've got behind me and all the other ones that are out there, we see our patients and then we plan our own treatment using these machines, and the results that we get are spectacular sometimes.